Hello, my name is Karina and I'm a Nursing 1 student. I was wondering, do you have Miss O'Connor today?
I do. I have Miss O'Connor here in room 231. Would you like to hear a little bit more about how she's been doing?
Yeah, that would be great.
Okay, so in room 231 we have Shanae O'Connor. She is a full code and she's on universal precautions. She has allergies to sulfa drugs. She was admitted for a fever of unknown allergies a few days ago. She has a history of diabetes mellitus type 1 and end-stage renal disease and recurrent urinary tract infections. She is on a renal disease diet with a 1,500 milliliter water restriction. She wears glasses. She's been a diabetic for 26 years. She's been complaining of a pain of a 4 out of 10. She does have an IV in her right median vein. And she's been complaining also of general malaise, decreased appetite, and increased blood glucose. When we took her blood glucose at 7:30 this morning, it was at 155. As far as her physical assessment, she has an AV graft, which has had no complications. She's had a 10-pound weight gain over the last week. She's complained about numbness and tingling in her lower legs and a decreased volume and frequency of urination, as well as her urine being darker and more concentrated, and she's had a temperature of 101.1. The rest of her was fine. Her lungs were clear to auscultation. She's ANO times 3. No other lesions or sores on her skin. She has some lab work pending. We have a CBC, a blood metabolic profile, and a culture and sensitivity of her urine. We did get her urinalysis back. It revealed cloudy amber urine with white blood cells of 15 per high power field and a few red blood cells noted. The pH of the urine was 4.7 with the specific gravity being 1.005, which is the low end of normal. So I was just going to go in and hang her normal saline and her medication if you wanted to come in and watch.
Yeah, that'd be great, but could I ask you a few questions about the medication first?
Yeah, sure.
Alright, so why specifically is the client receiving the medication?
Well, Miss O'Connor has had an elevated temperature and some white blood cells noted in her urine, so we are going to hang this antibiotic to treat some kind of underlying infection that she may have.
Okay, and what action does the medication have on the body?
Well, imipenem is a beta-lactam antibiotic. It is not something that Miss O'Connor is allergic to. It's different than the sulfa drugs, and it's mainly bactericidal. It inhibits the third and final stage of the bacterial wall synthesis, and the cilastatin, which is added to it, helps protect the liver because it can be toxic to the liver.
Okay, when would you question giving the medication?
If she were allergic to this class of medications, we would question giving it.
Okay, and does the medication have a therapeutic serum level?
It doesn't have a therapeutic serum level, but we want to monitor her complete blood cell count, her liver function enzymes, as well as a BUN and a creatinine.
Alright, what vital signs are you going to be monitoring?
We're going to be monitoring her normal vital signs just to make sure that she's not having an adverse reaction to the medication, as well as her temperature, because we want to make sure that her fever does not increase while she's on this medication.
Okay, and what physiological parameters are you going to be monitoring when giving the med?
We're going to be monitoring kind of how she feels overall. We're going to be monitoring her skin, make sure she's not getting jaundice. We're going to be monitoring her to make sure she's not having any anaphylactic type reactions to the medication.
Alright, and what are you going to be teaching to the patient to make sure that the medication is administered safely here at the hospital?
We want to make sure she's aware of the side effects of the medication so she can promptly alert her doctor. We also want to make sure that she is feeling well and not, having any of those anaphylactic reactions.
Alright, what about her taking the medication at home?
Well, this is an IV medication, so she probably wouldn't be receiving it at home. It is available in an intramuscular form if she were to take it at home, so she would just have to be aware of how to give them the medication intramuscularly safely.
Okay, what are some side effects and potential adverse reactions?
Well, we always worry about anaphylaxis with antibiotics, any type of seizure activity. We also want her to report if she's having any nausea, abdominal pain, any diarrhea, especially diarrhea with blood. This medication can also cause urine, tongue, and tooth discoloration, as well as heart palpitations and a decrease in urination.
Okay, and how do you know the medication's working?
Well, we would want to make sure that her fever is going down, as well as the white blood cells in her urine. We want to see that resolve.
Okay, well those are all the questions I have for now, if I can still come and watch.
Yeah, of course.
Hello, come in.
Hello, Miss O'Connor. I'm Lindsay. I'm going to be your nurse today. And I've got a student nurse, Karina, who's going to be shadowing me today, if that's okay with you.
Of course.
All right. How are we feeling today, Miss O'Connor?
I'm doing all right.
Well, that's good. So I'm here today to hang some IV medications for you today. Let me put on my gloves here. Do we have any allergies, Miss O'Connor?
I'm allergic to sulfur.
All right, well, this medication that we're giving you is not a sulfa drug. It's a different class of medications. So you shouldn't have any reaction. What was the allergy that you had to the sulfa drugs? What?
I have a rash on my skin all over my body.
Oh, no. Okay. Well, we're going to make sure that we don't have any rash with this medication since we've never taken it before. So if you experience any rash with this medication or any shortness of breath, any abdominal pain, any nausea, vomiting, or if you have any diarrhea with blood in it, please let us know immediately, okay?
Okay.
My cord's not very long here, so I'm just going to take your arm, and can I have you verify your name and your date of birth?
Shanae, Conan, September 22nd, 1981.
Okay, wonderful, thank you. I'm just going to scan you one more time. Sorry, Miss O'Connor.
Okay.
And I see you have your allergy wristband on. That's very good. So the first thing that I'm going to do is I'm going to flush her catheter and make sure that it's patent. Miss O'Connor, how does your IV catheter feel?
I feel nothing on that.
Good. So I'm just going to swab the site with alcohol for about 15 seconds. Make sure it's nice and disinfected. Make sure that it's unclamped, which it is. And then I've got a saline flush here. And all I'm going to do is just run some saline through here, Miss O'Connor, and make sure that I feel it flowing through, which it is. Do you feel any pain or discomfort?
No, just a little cold.
Okay, and I don't see any swelling, redness, or tenderness with that. So the next thing I'm going to do is I'm going to get her sodium chloride ready to hang. And it's going to be running at 30 mils an hour, and I'm going to get your fluid ready to hang.
Oh, okay.
Alright, and the time is 7:49. Just making some notes, Miss O'Connor,
Oh,
that your
okay.
catheter flushed well. Alrighty. So the first thing that we do is we check our sodium chloride. We give it a little squeeze to make sure the bag's not leaking. We make sure it is in date, and this doesn't expire until 2016, so it's good. It's clear, it's not cloudy. And then I've got my line here.
So what is that one for?
This is to help the medication kind of flow through your body. This is called a carrier.
Okay.
So this is just normal saline, which is what your body's cells flow through. So this is just going to help the medication flow through. So I'm just going to talk to my student as I do this. If you want to follow along, the first thing I'm going to do is clamp off my line.
That sounds like a good idea.
Yes, we don't want to spill our medication everywhere. So then we're going to unspike this bag. Going to remove my cap, and we're going to sterilely spike the bag here, making sure nothing touches because we want to keep Miss O'Connor safe. We don't want to prevent any more infection. And then I'm going to prime my line. I'm going to fill my drip chamber halfway. I'm going to unclamp this. And this just makes sure there's no air bubbles in the line, Miss O'Connor.
Oh, okay. See what you have done this many times before.
That I have, Miss O'Connor.
I feel better now.
All right, I'm just going to feed this in the machine here. And hang that up there so it doesn't touch the ground. All right, the next thing I'm going to do, Miss O'Connor, is I'm going to get your IV antibiotic ready. Now, Miss O'Connor, I know I just mentioned some of the side effects. What are we looking for, and what are you going to let us know immediately if you're feeling?
I think if I have diarrhea, nausea, vomiting, or if I feel dizziness or something, I think I should call you, I guess.
You should. That's excellent, Miss O'Connor. Okay. So same with the little medication here. I've got my line. I'm going to check the expiration date of your medication expires in 2019. It's clear. I don't see any leaks or cloudiness. I'm going to clamp off my line here. And I'm going to unspike this bag and sterilely spike this bag. And then I got to put my fluids lower than my medication here. All right, and now I'm going to connect the antibiotics to the IV line. So I'm just going to swab this for 15 seconds, just like I did with your IV catheter. I'm going to hook this up. And then I'm going to get all the air out of the line by back priming this bag. So what's really neat, Miss O'Connor, if I unclamp this and hang it lower than the fluid, you can see all the air come through.
Oh,
And that gets all the air out of the line.
that's very interesting.
Yep. All right, now I'm going to label and date my tubes here. Okay, Miss O'Connor. Now we're going to hook this up to you and get everything started to run, okay?
Okay, can't wait.
This should start making you feel better. I know we've had recurrent urinary tract infections before.
Yeah, it's a bit uncomfortable.
Yeah, so I know you know the signs and symptoms to look for.
Yes.
Now, one of the things that you can do to kind of help prevent urinary tract infections is to drink a lot of water, which I know is hard when you're on the water restriction. The other thing that you can do is drink cranberry juice. Cranberry juice is shown to help with
Oh,
it.
okay. I didn't know that. I thought it was a bit expensive.
Okay, hook you up right there, Miss O'Connor. Okay. I've still got everything all clamped off. I'll unclamp that before I turn it on. Alright, so now I'm going to turn the pump on. This is a new patient. We are on the medical surgical floor, so I'm going to hit yes. I'm going to do O for O'Connor. Okay, channel select. Channel A is going to be fluids. And we've got 0.9% normal saline. This is correct. Our rate is going to be running at 30 milliliters an hour. And it is a 500 milliliter bag. So we're going to enter 450 so I can come back and change your line before we run out of fluids in that bag.
It's a good idea.
Unclamp that, hit start, and then run a secondary. Oops. Secondary medication is going to be the Cilistatin imipenem, so we're going to go to imipenem Cilistatin. So it's 500 milligrams and 100 mils. Yes, this is correct. All right. So that is correct. So we're going to run this over 60 minutes. I'm going to make sure this is unclamped. And we're all unclamped here. Alright, and then I'm just going to watch it for, make sure it drips a couple of times to make sure it's running. Okay, this is running IV piggyback. And it looks like everything's running. And how do you feel, Miss O'Connor? Do you feel anything?
Not really.
Okay. All right, Miss O'Connor, your bed is down. You have your call light. Was there anything else that I could get for you? I've got some information about the medication here as far as what the drug is, side effects and stuff to look out for, just for you to read on your leisure time so you know a little bit more about this medication since you've never received it before.
Okay, so you highlighted for me. That's really
I did.
good.
I highlighted the key points for you.
Thank you.
All right, Miss O'Connor. Well, I'll come back and check on you in about an hour. You hit your call light if you feel anything, okay?
Definitely will.
All right, thank you.
Thank you for letting me watch your medication be administered.
You're welcome. Good luck with your study.
Thank you.
All right.
So I just had a few more questions for you, if that's okay.
Yeah, that's fine.
Was there any important information that you looked at before you gave the medication?
I did want to make sure that Miss O'Connor's IV was patent and it was flowing through. I did want to make sure that she wasn't allergic to this class of medications, which she was not. And I did want to make sure that I knew what her side effects from the previous medication were so we know what to look out for with any additional antibiotic administration.
Okay. Did that affect your decision to give it to her?
Well, since she wasn't allergic to this class of drugs, I went ahead and administered this medication. I made her sure she was aware of the side effects so she could alert us to promptly alert us if she's experiencing any additional side effects from this medication.
All right, and did that affect how you gave it?
No, it was going IV, and because her IV was patent, I went ahead and administered the medication IV.
All right, thank you so much. That's all the questions I
You're
have for now.
welcome.